Okay, AP Psych class, welcome to Unit 13. Only one more after this. Unit 12 was discussing mental health issues and the different categories of mental health issues. Unit 13 is going to discuss treatment of the psychological disorders, and so we're going to start with part 1, the psychological therapies. Okay, before we begin explaining the various types of psychological therapies, let's discuss what's known as the eclectic approach. The eclectic approach just means that realistically, you would be hard-pressed to find any psychologist that is trained in only one of the areas that we are about to discuss. That the goal of a psychologist nowadays would be to blend all of these therapies to match the needs of the individual patient. And so you're not going to be, looking in the phone book for a humanistic psychologist. Most will use the eclectic approach. Okay, psychotherapy is just client-therapist method of treatment, right, involving discussion of one's mental health issues with a trained professional. But there are a bunch of different types of psychotherapy. The roots of all psychotherapy come to us from Freud's psychoanalysis. Remember, he was the one that first said to get at the root of psychological issues, one should sit down with a therapist and just talk through one's problems, the talking cure. And so without Freud's psychoanalysis, as strange of a theory as it was, we probably wouldn't have any psychotherapy today. So remember, psychoanalysis would have been based on the thought that we were repressing childhood memories, and that we needed to use this free association, which would have been relaxation, on the proverbial leather couch, and just being allowed to say whatever came to one's mind. And that there any blocks in that free flow of, conscious stream would have been an indication of some sort of resistance, that the therapist would then interpret the meaning or the significance of the block. And then, the therapist would probably also be analyzing the latent content of dreams, and, any feelings that were, being transferred, to other individuals, or even feelings being transferred to the analyst or the therapist himself or herself. And so that's the roots of all of our psychotherapy, is talking through our problems. Okay, the psychodynamics is the modern interpretation, right, derived from Freud's original ideas, probably less focused on this repressed childhood memory as a result of our psychosexual development, and more on trying to teach self-insight, and focusing on themes across important relationships, or themes across different problems from one's past. A version of psychodynamic therapy would be interpersonal therapy, and the difference there is that the therapist actually talks with the client versus a traditional psychodynamic therapist just kind of sits and listens, and is taking copious amounts of notes, right, on his or her clipboard, but has isn't really talking alongside the client. And so interpersonal therapy would just be a slight alternative to traditional psychodynamic theories. Okay. Another type of therapy would be humanistic therapies, often referred to as insight therapies, but they're slightly different from the psychodynamic theories in that, yes, they are helping one focus on, being in touch with one's own feelings, but the humanistic therapies will focus more on present and future issues, and not necessarily past events being what makes us feel what we feel now. And the humanistic therapy would also be encouraging growth rather than viewing mental health issues as some sort of illness that needed cured by a superior therapist. And so Carl Rogers, right, one of your big humanists, was very into client-centered therapy. Notice I said client, not patient. And would have encouraged things like active listening, right? encouraging people to talk freely about their issues, restating what they've said and seeking clarification of what the person's expressing, acknowledging the feelings that they express, but really the therapist taking a back seat and really just being the mirror, giving unconditional positive regard to encourage the person to grow and develop as a human, to overcome obstacles on his or her own, and just being more of a guide through that process. And so still a psychotherapy method, but slightly different than the psychodynamic procedures listed in the bullet above. Okay, behaviorists have their own form of therapy known as behavior therapies. So in this, we're going to take everything from Unit 6. We're going to apply our principles of learning to eliminate unwanted behaviors. And so behavior therapy is used a lot concerning phobias or obsessive compulsive disorder, and there are a couple of different types of behavior therapy. Exposure therapies, which would include systematic desensitization, which we discussed in Unit 6, right? Using progressive relaxation techniques and gradual exposure to some sort of feared stimulus until the response of fear is eliminated. Virtual reality programs can be used, like in the cases of anxiety disorders, like post-traumatic stress disorder. Oftentimes, virtual reality is used as a way to decrease the anxious response to fake tragic events that are being exposed in the virtual reality world. So those are the exposure therapies, but then you also have behavior therapies that would be referred to as aversive conditioning. So it would kind of be like reverse or opposite conditioning, where you're going to teach someone to avoid something bad. So like drugs and alcohol would be commonly helped using aversive conditioning. And so, we talked about this as well when we talked about Unit 6, in giving somebody something that they think is the drug they're addicted to, and when they no longer when it's a placebo and they no longer get the high that they are used to, they're no longer going to desire to take the drug. Or even better would be situations where whatever substance has also been laced into the alcohol or whatever will make them so sick that they try to avoid it at all costs. The key to aversive conditioning is that it helps in the short term, but doesn't seem to have as good of long-term effects as some of the exposure therapies do. But behavior therapies, obviously, working in that theory of behaviorism. Of course, you could focus on the positive as well. Behavior modification would be reinforcing desired behaviors and punishing undesirable behaviors. An example, like a token economy, where the person would earn some sort of reward from the therapist for exhibiting a desired behavior, and could later exchange that reward for privileges or treats or what have you. And so one of the critiques there, obviously, is how durable will this learned therapy be? And, there's some question, and, is it right for one person to control the behaviors of another? But concerning some of our phobias, those anxiety disorders like OCD and PTSD, they do come in handy. Okay. Cognitive therapies would be related to that last part of Unit 6, right? Cognition, right? That we have control over our own thoughts and actions, and that we could teach people new adaptive ways of thinking and acting. And it's based on this belief that thoughts can intervene between events and our emotional reactions. One of the big researchers in this field is Aaron Beck, who talked about reversing the negative feelings about, yourself, like self-destructive thoughts. And teaching somebody when to recognize the onset of symptoms and how to, use their mental resilience to overcome those obstacles. A slight variation of those would be cognitive behavioral therapy, which would be a blending of all of Unit 6 together, right? The behavior techniques that we just mentioned, plus changing negative self-thoughts. And so those are good, a good blending of therapies there. And then family or group therapy is an option as well, where it's not a one-on-one therapist-client situation, but a group of clients and one therapist. There are some benefits to family or group therapy. First, it's a relief to know that you're not alone, right? That others are experiencing the same issues that you yourself are experiencing. You can receive, support from the other people in the group. It teaches a lot of self-help because the therapist isn't, one-on-one, but instead is teaching more of techniques on how to help yourself. And truthfully, in this day and age, when a lot of insurance, balks at covering the cost of one-on-one therapy, family and group therapy might be the only affordable option out there for a lot of individuals. And so that's another rationale for its existence, or a benefit of its existence. Okay, so that's your overview of the different psychological treatments for mental health issues. In the next video, we are going to evaluate the effectiveness of psychological therapies. And then in your final video for Unit 13, we will discuss and evaluate the biomedical therapies. So bring any questions that you have for class. And as always, thanks for listening.